Hey guys, welcome back to part 5 of our anatomy focused series, and we're talking about the ear. So we've explored the anatomy of the ear, so we know we've got the pinna, our vertical and our horizontal canal and all the different components in there. So what common conditions impact our ear? So one of the most common ones we have is otitis externa. So that's when we have inflammation of the external ear canal. So we can see on the image here. So often caused by allergies, infection, moisture, foreign bodies, and we get this cascade of events where it becomes really painful and very inflamed. We have otitis media or interna, where we start to impact the canals here, and it's that extension of that chronic ear disease. Again, may cause a lot of pain, but we often see some vestibular signs in there as well. So something we commonly look out for is, anything impacting balance, proprioception, and again, those vestibular symptoms. We have allergic otitis, which is recurrent. It's often affects both ears, so it's bilateral, and again we get that inflammation. It's associated normally with atopy, often food allergies, things like that can impact. We have oral hematomas, so it's again normally impacting that external part of the ear, and it's blood accumulation in that pinna. So we know we have obviously the auricular cartilage, and it's in between those spaces where we get this pooling of blood, and it's often caused by head shaking, trauma. Commonly that they had otitis first, and then as a result of the itching, the pain, the discomfort, the shaking, they then develop a hematoma. We then can get foreign bodies. If something gets stuck down that canal, again causes a lot of pain, can cause inflammation if it's an irritant there, and again if the dog starts scratching. It's normally only impacting one ear, so unilateral, things like grass seeds, things like that. Then we go down the avenue of bugs, so ear mites, also known as otodectes, pruritus, pruritic parasitic otitis, what we commonly see, and common in young or multi-pet households where bugs like to share owners. Then we have chronic ear disease, where this is obviously it will start with an acute ear infection, and this is something that may be reoccurring or it's not going away. And the problem we have is just like here, we get kind of internal ear canal thickening, fibrosis, and in severe cases we get mineralization, and they're really difficult to treat and manage. And finally, neoplasia. This could be benign or malignant masses that cause obstruction and secondary otitis. So lots of different conditions that impact the ear. As we can see, it's complex, but a small area. So there's lots that can go wrong here. So they're quite challenging, can be quite challenging to treat, especially in patients that are very painful and don't want those ears to be touched. So that's a quick highlight of some of the most common conditions that we see that impact the ears. Stay tuned for our next session, where we start to look at how could laser therapy help some of those conditions. And if you've got any cases where you have seen any of these, then drop them in the comments below.